What do you think is going to happen when Medicare runs out of money in 2026? Medicare, an insurance program that we all buy into throughout the course of our lives so that when we are elderly, we can get medical care coverage. That's set to expire in less than 6 years because we simply don't have the funds. So I want you to picture this. I want you to picture that you're going to your parents' house, and there they are, and your dad has a broken arm. He's 65. He's on Medicare. But he looks at you, and you look at him, and you say, "Dad, why haven't you gone and got your broken arm fixed?" And your father says, "Well, it's because I don't have a job anymore. I'm on a fixed income, and I no longer have health insurance. Medicare is over." What's going to happen to your father? And I don't want you to think of this like some far-off doomsday scenario. This is less than 6 years away that Medicare is set to run out of money. 6 years away. Medicare covers about 18% of the population. Medicare spending accounts for about 15% of all federal spending, 15%. And it's there as a safeguard so that when we no longer work, when we no longer have employee-sponsored health benefits, that the government will pay us back for all that money that we put in our entire lives of working. It's not an entitlement program, and I want to be very clear about this. Medicare is not an entitlement because you've paid into it your entire life. So let's say you're 30, and you sit there and say, "Hold on, Reagan. I've been paying into this for 10 years. You mean I'm going to get nothing?" That's exactly what I'm saying. What about you who's 64 and you're about to retire, thinking that medical coverage is going to be basically taken care of when you're 65 and older, at least 80% of it? And I just told you, look, no longer the case because Medicare is about to go bankrupt. What does that do for what you've been planning for your entire life, what you've been putting into the system your entire life? Medicare has been so mismanaged that it's about to go bankrupt. Now, there is a fiscally conservative approach to this that matches very nicely with the socially responsible approach, and that's the common sense solution. We need to be able to price negotiate. We need to take care of ourselves. We need all of these things that we're discussing in all of these video series. They need to happen so that our Medicare program can be solvent, so that you can get care you need when you're elderly, so that your parents can get the care that they need when they're elderly. It is egregious what we've allowed Congress to do, to misappropriate funds, to not hold insurance companies accountable, to not be able to price negotiate drugs, to not hold us individually accountable for our healthcare choices throughout an entire life. There's always an easy answer, and it's almost always wrong. All of medicine needs an overhaul. And that's why we're doing these videos, because education is power. I want you to know what's going on with healthcare. I don't want you to just sit back in your home and listen to two politicians fight and squabble, so much so that you step back and say, I don't want anything to do with this. Whatever they decide goes. That no longer flies. That might have flown in my parents' generation when politicians still cared a little bit about the country, not just about their political party. You and I, we need to take back this country. It's not Republican, it's not Democrat, it's American. And what's right for America is to be fiscally conservative and socially responsible and find the common sense. We cannot let Medicare crash in 6 years. The choice is yours. The choice is mine. Are we going to hold our politicians accountable? Or are we going to keep letting them squabble and get nothing done until the point where your father has a broken arm that he just has to live with? To learn more common sense solutions, to learn how you can personally get involved, and to be the change you wish to see in the world, subscribe to this channel, and we'll let you know when new videos are out. Please also check out the book I wrote, Universal Death Care, a solution for healthcare in the age of entitlement.